name is Malika, and I'm a physician assistant student, and I'll be assessing with your visit today. So, before we get started, can you confirm your first and last name and date of birth?
Yes, it's Lauren Summer, June 7th, 1950.
Okay, great. And then how would you like to be addressed today?
Lauren is good.
Okay, and then what are your pronouns?
She, her.
Okay, great. So today I saw in your chief complaint that there has been something about confusion and things like that. So today I might do a mini mental state exam on you. Do you consent to that?
Mm-hmm.
Okay, great. All right, so can you tell me a little bit more details of what's been going on?
Yeah, so I've just been feeling, like you said, kind of confused lately. And I'll find myself not remembering why I came into a room or what I was doing, and then forgetting my plans, like dates and appointments and stuff. And my daughter's been having to call in a lot and check on me to make sure I'm going to my appointments.
Okay.
Just not remembering, which is unlike me.
Okay, yeah. So I think the best thing to start off with is a mini mental state exam. So we'll get started with that. And so the first thing on the exam is orientation. So can you tell me the year that we are in?
It's 2024.
Okay. And then do you know what season we are in?
I don't know, it's starting to get hot, so maybe the summer, I guess.
And then do you know the date today?
I couldn't tell you that.
Okay. And
I'm
then
not quite sure.
And then do you know what day it is?
I've lost track.
And then what about the month?
I think it's May.
Yeah, good. And then do you know what state we are in?
We're in Texas.
And the country?
The United States.
And do you know the town we are in?
We're in Dallas, Richardson.
And then do you know the building that we are in?
The doctor's office. I forgot the exact name.
And then do you know what floor we are in right now?
I think it's the 3rd floor.
Yeah, good job. So now we're going to move on to registration. So for this one, we're going to name 3 objects for and say it 1 second each, and then I'll ask you to say those all 3 of them after I have said them. Okay. So all right, so I will say 3 words and then you will repeat them back to me. So clock, shoe, and house.
Clock, shoe, and house.
For attention calculation, I will have you say count back from 100 in series of 7. So 100 and then the next number in
7.
Yeah, 5 times.
So 93 and then 82, 75, 68, and 60.
All right, and then now for recalls. So now I'm going to ask you what those 3 objects were, what I said previously.
Oh no. Clock was one of them.
Mm-hmm.
Oh gosh darn, I can't remember the other ones.
Okay, that's okay. Now we'll go on to language. So I'm going to have you say what this object is.
It's a pen. It's a pen.
And then can you tell me the object of this?
That's a watch.
Yeah, good job. Now I'll have you repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
All right, good job. And now we're going to do another activity. So, oh, wait, no. Okay, so for this one, I will have you fold this paper in half and then put it on the floor. Right, good job. And now I'm going to write a sentence and then I will have you do this sentence. Right, good job. And for the next one, I'll have you write a sentence. Nice. So am I. And now I have you copy this design right here. Alright, that was pretty good. And that concludes the mini mental state exam. So I will calculate this and I will be right back and tell you more information after that.
Okay, thank you.
Alright, hi. Are you doing good?
Yeah, I'm doing good.
Okay, good. So after reviewing the mini mental state exam, it looks like your score is a 23 out of 30.
Okay.
And it looks like the most missed scores were in orientation and attention and calculation. So for this, I would first start off with reading and making sure that you are reading a couple of books a month, and also being involved in social activities and be engaged in like new types of groups that you haven't been in before, like volunteering or trying something new every month. And then also to challenge your mind, you can do puzzles and Scrabbles and games. And I would also suggest you have a calendar for like appointments and to keep track and write everything down, and you can take it with you everywhere. And then I would also have you maybe have a journal where you can write down everything that you need to do for the day and what you have planned for tomorrow. So your mind is more organized on paper. And then I would also suggest you exercise and diet also to help improve the brain cells and just keeping a healthier life long term. How would the ethnicity, race, gender identity, and social determinants of health of my patient affect my interpretation of the mini mental state exam? Well, my answer to this would be people's culture and background plays a huge role in the mini mental state exam. And one example is language. When speaking to patients and asking questions regarding the exam, I would need to make sure that there is a translator present and I am clear and concise with my words. The patient understanding what the questions are is crucial to the answers that they will provide an overall assessment by the provider. Another example would be socioeconomic status. Patients who have been exposed to a low socioeconomic status would react differently to the questions on the exam compared to people with a high socioeconomic status. For example, someone in a low socioeconomic status may have not had proper mental health care or medical care earlier in life, which could affect their current mental state. Lastly, gender identity is crucial for the client to feel respected and heard. As a PA, it is our responsibility to ask what their pronouns are and be respectful and make sure that we are educated in order to provide the best help possible with our healthcare service. The second question is, what would a preliminary treatment plan that incorporates evidence-based strategies for managing cognitive impairment? Basically, I would say cognitive rehabilitation is very important and engaging in structure and cognitive exercises and activities. And for example, a patient can use computer-based cognitive training programs, occupational therapy, and like, for example, tailored activities to improve the daily function and independence. Another example would be lifestyle modifications. I would say a diet, especially promoting a balanced, healthy, rich diet in vegetables and whole grains and lean proteins and healthy fats, is very important to improve a patient's cognitive health. Exercise is very important for a patient. It encourages regular activity, like encouraging regular physical activity such as walking, swimming, and yoga at least for 150 minutes a week is very crucial for keeping the brain healthy. And also sleep. Sleep is very important to ensure that we are keeping control of managing sleep disorders to prevent less symptoms of cognitive impairment. Another treatment plan would be mental stimulation. It is very important to exercise the brain and encourage activities that stimulate the mind, such as reading, puzzles, social engagement. It is very important for a patient to engage in new types of social environments and new activities that they haven't done before to really challenge the brain. And another treatment plan that is very important is supportive care, especially by caregivers and like their family members. It is really important that they get the support they need in case if they're confused and like lost at a certain place and they can't find their way. It is very important that there is someone always there for them and always checking if they are where they need to be and making sure that they are not in any danger. And another plan would be to use memory aids like calendars, lists, and alarms, so the patient has an organization on paper that can help them understand what they have to do throughout the day, and it's not affecting their daily life. Overall, multidisciplinary approach involving healthcare providers, caregivers, and support services is crucial in managing cognitive impairment. The next question is, reflect on your communication technique during the encounter. Were you empathetic and respectful? How so? How could you improve the communication in future patient interactions? I would say my communication style was focused on empathy and respect by trying to understand how the patient feels and encourage them when they get the answers right. But however, I would improve my communication by making sure I speak more clearly when I'm explaining a section of the exam. For example, when I'm explaining the registration part, I need to be more clear and concise so I do not confuse the patient. For future patients, I would make sure I'm more prepared on how I'm going to explain things to them and making sure that decrease more confusion for the patient so they can get a clear picture of what exactly they need to do.